Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Cooper-Smith, a doctor-prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. So a few weeks ago, we hit a milestone, 50 episodes, and we didn't take a moment to celebrate that, so we'll remedy that today. We're going to take a moment to pause, reflect, and celebrate. We'll look at the highlights of the show so far and then feature some commonly asked questions. So what started as an idea to elevate, inspire, and empower people to take control of their health has grown into an incredible journey. As we celebrate the first year of this podcast, I am filled with gratitude for our guests, our listeners, and the community who have joined us along the way. So over the past year, we've explored some of the most important and often controversial topics in health and wellness. We've had meaningful conversations about hormones, menopause, testosterone, medical weight loss, nutrition, longevity, fitness, mindfulness, and healthy aging. We've challenged the conventional thinking, and we've examined emerging research and shared practical strategies that listeners can apply to improve their energy, vitality, and quality of life. So one of the greatest joys of hosting this podcast has been the opportunity to interview a diverse group of experts, including physicians, nurse practitioners, researchers, authors, entrepreneurs, coaches, athletes, advocates, and other wellness leaders. These are guests I never would have met had it not been for this show. They've shared their expertise, personal stories, and life lessons, providing valuable insights that have educated and inspired our audience. This year also marked the beginning of a new personal adventure that many listeners have followed along with us, my Appalachian Trail section hiking journey with my husband, Jerry. Through these trail stories, we've shared lessons about perseverance, overcoming challenges, embracing discomfort, and finding joy in the journey. The mountains have become a powerful metaphor for health, growth, and life itself. Perhaps the most rewarding part of the first year has been hearing from listeners who have taken action because of something they heard on the podcast. Whether it's starting hormone therapy, improving nutrition, prioritizing exercise, addressing burnout, or simply feeling less alone in their health journey. These stories remind me of why this work matters. So as we enter our second year, our mission remains the same: to provide trustworthy information, thought-provoking conversations, and practical tools to help people optimize their health with greater energy, purpose, and vitality. So one of my favorite topics is nutrition. And this year, we reviewed the new dietary guidelines, discussed the saturated fat controversy, and interviewed various experts who gave their insight on healthy eating. So now we'll explore some of the questions I've received from you. So first question: does eating fat make you fat? Well, the answer is maybe. Weight gain occurs when we consistently consume more calories than we burn, regardless of whether those calories come from fat, carbohydrates, or protein. 1 gram of fat has 9 calories, while protein and carbs each have 4 calories per gram. The concern is that if we eat too much fat, then we'll get too many calories and thus gain weight. However, healthy fats from foods like avocados, nuts, olive oil, eggs, they can actually increase our satiety, meaning we feel fuller longer and we're less likely to overeat. When you eat a meal higher in carbohydrates, especially when they're simple carbohydrates, your pancreas has to secrete more insulin, and sometimes you end up with a rebound hunger, actually causing you to consume more calories overall. So the quality of our food matters more than the amount of fat per se that it has. The next question: are seed oils really harmful? So we did a show that highlighted the potential dangers of seed oils. Later, I was listening to a podcast from a well-known health expert, and she said she didn't think it was that big of a deal. And I was really surprised, and I wanted to find out more. Why did she think that way? So on our show, we talked about the research that showed that highly processed seed oils can contribute to inflammation, metabolic dysfunction, and disease. So when we talk seed oils, we're talking about oil derived from small seeds like corn, sesame, also the processed oil like canola. So the problem is not the seed itself, but the manner in which it's extracted. So it's really difficult to get the oil out of a really small seed. So they usually have to do something to it. Sometimes they have to add chemicals or solvents, and this is going to make them more inflammatory. Also, the chemical structure of those oils, they're polyunsaturated fats and they contain many double bonds, and it makes them more unstable and prone to oxidation, which causes inflammation. Now, on the other hand, there is still a longstanding belief that replacing our saturated fats with these polyunsaturated fats is actually good for our health and our heart. We haven't quite reversed that yet, and there's a lot of conflicting evidence. So people in this realm really feel that it's not the seed oils that, these polyunsaturated seed oils that are causing the inflammation. The problem is that many processed foods and ultra processed foods contain seed oils, but they also contain a bunch of other stuff that we know isn't good for us. So anything in a package is going to be processed to some degree. And there is a lot of evidence that ultra processed food really are more fake items than real food, and they're the things that are actually harmful. So with that said, most experts will agree that reducing your ultra-processed foods anyway is a good idea, regardless of where you stand on the seed oil debate. So here's what I do. I use avocado oil and olive oil. So these oils, the seeds from these items from avocado and olive are bigger, and so we're more easily able to express that oil from them more safely. Quality still matters, though, because you can get low-quality oils. But using a high-quality avocado oil for cooking is very good. It does really well at a high temperature, and so it's not going to oxidize. You also can't taste it in your food, so it's a good choice. Now, olive oil I'll use for my vegetables when I'm roasting them. I'll also use them on salad dressings. Next question. How much protein should I eat? So for most active adults, they're going to need more protein than the minimum recommendations. So a common target is about 0.8 to 1 gram of protein per ideal body weight. So I encourage people to try to get at least 30 grams of protein from each meal and shoot for about 100 grams per day. So adequate protein is really important for our muscle preservation, metabolism, satiety, recovery from exercise, and healthy aging. So it's especially important for somebody on a weight loss journey because without adequate protein, we lose muscle. So speaking of weight loss, a conversation wouldn't be complete without addressing those GLP-1 medications. So we did a whole show that looked at the pros and the cons of the medications. So questions related to that. Do GLP-1 medications like semaglutide and tirzepatide actually work long term? So these medications can be a really great tool when it comes to weight loss. So when I say tool, what I mean, it's one of those things in your arsenal that to help you achieve your goal. It's really important to combine this with lifestyle changes. So the medication itself is going to reduce appetite, improve blood sugar, and support weight loss. Sustainable success really depends on developing healthy habits in conjunction with that and preserving your muscle mass through adequate protein and strength training. So if a person loses weight but doesn't make those sustainable healthy habits, the weight will return, and usually they're worse off than before. So next question. I want to try GLP-1 medications, but I'm worried about the side effects. What are the most common side effects? So all medications can have side effects, and the ones that we see most commonly with the GLP-1s are nausea and heartburn, constipation and or diarrhea, bloating, feeling overly full, fatigue, hair loss, and muscle loss. So the good news is that most of these side effects can be managed with proper dosing, proper nutrition, and hydration. So most of the GI symptoms, they're most noticeable when you first start treatment and also when your dose is increased. So it's really important to increase dosing slowly and under medical supervision. So one of the most important things is for patients to stay hydrated. Dehydration is a really common cause of people just feeling yucky, whether it's headachy, fatigue, even constipation. So drinking lots of water and sometimes even adding electrolytes to it is going to be important. And with that constipation, also eating fiber, especially when our nutrition intake is low. Some people just find that they just don't move their bowels as much, which is not good. Sometimes we need to add a little magnesium as well to support that. For people that get nausea, eating smaller meals can be helpful, eating more slowly, and avoiding greasy and large meals. And so this is something that actually really helps people because when they overeat something, they don't feel very good at all. So they're less likely to do that in the future. Again, we really want to focus on our proteins because we're not as hungry. So getting that protein in first is important. Also, it's important not to wait until you're extremely hungry because that's going to lead to overeating and maybe less healthy choices. Not eating enough and not eating enough protein is going to contribute to just fatigue and muscle loss and even hair thinning. We've heard about that. So now the most crucial side effect is that loss of muscle mass that we've alluded to. So weight loss should ideally come from fat, not muscle. So that's why I strongly encourage strength training along with that protein intake while you're using these medications. So now serious side effects can be extreme abdominal pain, vomiting that doesn't stop, dehydration. So if those things happen, it's really important to contact your health provider. Don't ignore those. So that leads us to healthy movement. So one of the most important things we can do to support our health and well-being is to move. So first question, what is the best exercise for weight loss? Well, it depends. So first of all, 80% of our weight is determined by our nutrition intake. 10% is from exercise and 10% is genetic. So we also know that lifestyle factors like stress and sleep can affect weight. The best exercise is one that you will consistently do. So that said, strength training is often underappreciated. So building your muscle is going to help you maintain metabolism, improve your insulin sensitivity, and support your long-term weight management. Combining resistance training with walking and cardiovascular exercise is going to create a more balanced approach. So now many people assume that the best exercise for weight loss is going to be hours of cardio. So while walking, cycling, swimming, and other forms of cardiovascular exercise that increase your heart rate is certainly going to burn calories and improve overall health, too much cardio can actually hinder your weight loss. So exercising more than 1 hour might cause an increase in cortisol production, which can increase hunger and fat storage. So I know it's kind of counterintuitive, but too much exercise sometimes works against us. So also as we age, we can naturally lose our muscle mass through a process called sarcopenia. So since muscle is metabolically active, losing our muscle slows our metabolism, and that makes weight management more challenging. So strength training, again, is going to help preserve that muscle, improve our insulin sensitivity, and support bone health. Now we're going to pause for a break from our sponsor. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Cooper-Smith. And before the break, we were talking about a year in review of the Energize and Revitalize podcast. And we have also featured some commonly asked questions. We were talking about healthy movement and why we need to have a healthy combination of cardio and resistance training. Now, I really like to follow, there's an exercise physiologist and women's health expert named Stacy Sims. You may have heard me reference her before. And if you haven't caught her, she's all over on many health and wellness podcasts. And I would strongly encourage you to check her out because she's just amazing, especially when it comes to things that influence women. So she reminds us that women are not just small men when it comes to exercise and nutrition. So many of the traditional weight loss recommendations were developed based on studies that were performed on young men. So a lot of times they don't really apply to women, ideally, especially during perimenopause and menopause. So according to Dr. Sims, women over 40 really benefit from lifting heavier weights. So not just the resistance training that we've talked about, but really increasing that weight. Most women are not going to get bulky from lifting weights. We just don't have the hormone composition to do that. So prioritizing that strength training 2 to 4 times a week. And then when we do cardio, to do shorter, high intensity bursts of cardio. Now this hurts more, but you do get it done quicker. So maybe instead of doing an hour walk, doing some speed walking, doing some stair climbing, and it is going to make you out of breath. You will have to have periods of recovery after it, but it is healthier for our longevity and our heart health and our weight loss. And again, she emphasizes consuming protein. And we really should focus on performance and body composition rather than just a number on the scale. So again, what we've seen, a lot of people have excessive cardio combined with severe calorie restriction. And sometimes that works when we're young, but when we're older, it just doesn't work anymore. And that can actually slow our metabolism down, contribute to muscle loss, and it makes it harder to maintain that healthy body composition. So again, it's about shifting our focus from the number on the scale to just being healthier, having a good metabolism. So now, hormones. We've talked a lot about hormones on this show. So the first question is one I hear often from both my hormone clients and my weight loss clients. So I'm eating the same and I'm exercising the same. Why am I gaining weight? Or the things I used to do to lose weight just aren't working anymore. So as we age, several factors make weight loss more challenging. We talked about our muscle mass naturally declining. Our hormones are changing and our metabolism slows slightly. Insulin resistance becomes more common. So the good news is that weight loss is still possible, but sometimes we need to shift our approach. So instead of eating less and exercising more, we need to optimize our protein intake, build our muscle, manage stress, improve sleep, and sometimes address our hormone imbalances. So hormonal changes can make it easier to gain weight and harder to lose it. Estrogen affects our insulin sensitivity, our fat distribution, appetite regulation, and muscle maintenance. And testosterone is actually one of the first hormones to decline in women. So when we lose our testosterone, it affects our energy levels, which affects motivation. It makes it harder to exercise. So some people do find that hormone optimization allows them to lose weight and build muscle. However, this can take time. So I never promise weight loss when someone starts hormones, but it can be a wonderful tool to help people to achieve their goals and enhance their well-being. So question, how do I know if I'm a candidate for hormone replacement therapy? So it starts with a lab test, but our symptoms also are going to tell us almost as much as the lab work. So common symptoms include fatigue, brain fog, low libido, weight gain, poor recovery from exercise, mood changes, hot flashes, and sleep disturbances. So when we are treating with hormone therapy, we're not necessarily trying to normalize numbers, but we're trying to help people feel their best and to function their best. So question, I don't have hot flashes anymore. Does that mean I'm over menopause? So one of the biggest misconceptions about menopause is that it's something you go through and then get over. In reality, menopause is not an event, it's a life stage. So technically, menopause is diagnosed after you've gone 12 consecutive months without a period. After that, you enter postmenopause, which lasts the rest of your life. So symptoms like hot flashes and night sweats may improve or disappear over time, but the hormone changes associated with menopause will remain. So without hormone optimization, estrogen and testosterone levels remain significantly lower than they were before you entered menopause. So some women continue to experience symptoms like poor sleep, brain fog, just joint aches, vaginal dryness. urinary symptoms, mood changes, and difficulty maintaining their muscle mass. So estrogen is going to help support our brain health. It supports our heart and blood vessel health. It supports our bone density and helps prevent osteoporosis. It's good for our metabolic health and our skin for elasticity and collagen production. So the conversation around menopause is beginning to shift from simply treating symptoms to supporting healthy aging. So question, is hormone replacement therapy safe? For many healthy women, hormone replacement therapy can be both safe and beneficial when it's appropriately prescribed and monitored. So treatment is always individualized based on symptoms, medical history, risk factors, and personal goals. So next question, what about breast cancer? So this is one of the most common questions I hear in practice. So much of the fear surrounding hormone replacement therapy comes from the Women's Health Initiative, which was published in 2002. So the headlines led many women and healthcare providers to believe that all hormone therapy significantly increased breast cancer risk. However, over the years, researchers have reanalyzed that data and discovered that the story is more complex than that. So an important distinction is that not all hormones are the same. The Women's Health Initiative primarily studied synthetic estrogens and synthetic progestin. So many experts believe that the risks observed in that study may not apply equally to bioidentical hormones or other forms. So here's a caveat. I always tell people, if you have already in your breast a hormone-positive tumor, and I give you hormones, even the good kind, that cancer could get worse. So it's very, very important to have preventive screening and to also practice healthy lifestyle factors to mitigate that risk. So when I discuss hormone therapy with clients, I focus on individualized risk assessment, and we review history, risk factors, and symptoms, quality of life, and treatment goals. So that leads us to, what are bioidentical hormones? Well, these are hormones that have the same molecular structure as the hormones naturally produced by your body. So when your body receives a bioidentical hormone, it recognizes it and uses it in the same way it would its own hormones. We're going to have fewer side effects when we receive it in this manner. So common bioidentical hormones include estradiol, progesterone, and testosterone. So these hormones are derived from plant sources such as yam or soy, and then processed to be chemically identical to human hormones. So bioidentical hormones can be delivered in several forms, including pellets, creams, gels, patches, and troches. Again, they should be prescribed and monitored by a qualified healthcare professional. So next, we're going to shift and talk about our Appalachian Trail adventures. So a really fun part of doing this show has been talking about the Appalachian Trail. So first question, what has it been like hiking the Appalachian Trail with your husband, Jerry? Well, it's been a challenge for sure. And Jerry might have a different answer, but he's not here. So it really has been a very rewarding part of our journey. We've spent hours together on the trail, and that can remove a lot of the distractions of everyday life. It can create opportunity for meaningful conversations and shared experiences. Jerry and I have been married for 28 years, and so it can be easy to get into kind of a rut and we each do our own thing. But this has really given us something to do together. We've celebrated accomplishments, worked through challenges, laughed at wrong turns, and really encouraged each other during difficult climbs. So it really has strengthened our partnership, and it reminds us that some of life's best memories come from shared adventures rather than the destination. So question, what's been the hardest part of hiking the Appalachian Trail? Well, most people assume the hardest part is the physical challenge, the steep climbs, the rocky terrain, and sore muscles. While those things certainly can be difficult, the hardest part for me has actually been quieting my mind. So in everyday life, I am constantly thinking about my patients, my business, my staff, you name it, I think about it. So, when I'm hiking, after a while, sometimes I have to stop thinking. What really helps is many times on the trail, we lose our cell reception. So I actually can't work while I'm hiking. So that's been a big blessing for me because it really is important to unplug and disconnect. So being on that trail has really become a form of meditation, and it forces me to slow down and let go of things I can't control and to focus on what's directly in front of me. So that brings us to mindfulness. And I've really enjoyed interviewing guests exploring many aspects of mindfulness and alternative health practices. So people ask, can breath work really affect my health? And the answer is absolutely. Breathing is one of the few body functions that is both automatic and under our conscious control. So slow, controlled breathing can help us lower our heart rate, reduce stress, help our hormones, improve focus, and activate the parasympathetic nervous system, which is our body's rest and recovery mode. So something as simple as taking 5 slow breaths can change how you feel in a matter of minutes. So we're almost out of time for today. But in closing, the most important thing to remember is that there is no one size fits all to your health. Your hormones, your nutrition, your exercise program, and treatment plan should be individualized just for you with your unique needs, goals, and lifestyle. And remember, small, consistent changes can produce the greatest long-term results. So 1 year, dozens of expert guests, countless health insights, and one mission, helping you live with more energy, vitality, and purpose. If you have a question you'd like answered on a future episode of Energize and Revitalize, send it my way at radiantpodcast2025@gmail.com. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live a radiant and healthy life. Until then, here's to our best life.